Good afternoon, Hoosiers. Welcome to our new format for our briefing and press review. Dr. Weaver and I are really excited to be here this afternoon with you. I wanted to let you know we are committed to continuing to do these on a weekly basis. Next week's time is still a little bit up in the air because of other commitments that we have, but we will be looking forward to seeing you back next week at the same time. I will start as usual with some underlying comments about changes that we've seen in our numbers. Today, we reported 1,302 additional cases of COVID-19 in Indiana, which brings our total to 128,227, the number of Hoosiers known to have COVID. We also saw 17 additional confirmed deaths. To date, 3,500 Hoosiers have died of COVID-19, and another 227 are believed to have died from this disease based on their clinical diagnosis. Our 7-day positivity rate for total individuals tested was 5% as of September 30th, while the cumulative rate for all tests was 5.8%. We continue to keep a close eye on hospitalizations. As of yesterday, a total of 1,081 Hoosiers were hospitalized with COVID or symptoms of COVID. But we cannot make an apples to apples comparison to over-hospitalizations in the prior year. Earlier in the year, there were no elective procedures in the hospitals, but now there are. And we know more about the virus than we did in April, and our systems are better equipped to handle these patients than they were at that time. We're keeping a close eye on this number, especially as we enter the flu season. We want to ensure we don't overwhelm our hospital systems with flu, COVID, or other respiratory illnesses. Currently, 51.7% of ICU beds and 16.8% of ventilators are in use statewide. The majority of those are being used by people who do not have COVID-19. However, we are seeing ICU bed capacity shrink in some areas of the state. Most of these areas already have a smaller number of beds available and are seeing increased need for ICU beds for non-COVID illnesses. But it is another data point that we are watching closely. Our hospitals around the state have worked hard to build capacity. We want to ensure that we preserve that capacity in the coming weeks and months. We also are seeing some shifts in the number of counties in orange on our color-coded map. As a reminder, we take the average score of the number of new cases per 100,000 residents in the last week and the percent positivity, then assign a color of blue, yellow, orange, or red. Blue has the lowest incidence of COVID-19 and red has the highest. Last week, we had 4 counties in orange and no counties in red. This week, we have 8 counties in orange and 1 Pike in red. I want to emphasize how little it takes to change a county's score and color. Some of the changes you are seeing this week are the result of outbreaks in long-term care facilities. Another county is dealing with the fallout of more than 30 cases tied to a single event at which people gathered indoors in close proximity without wearing masks. In many instances, these are preventable cases, so please help us by doing your part and avoid a spike in COVID within your county. Keep in mind that our temperatures outside are going to continue to drop now that we're officially in the fall, and that is going to make it harder to hold activities outdoors. As people come inside more and as flu season ramps up, we need Hoosiers to be more vigilant about hand washing, social distancing, and wearing your masks. I know you're tired of wearing masks and staying apart. We all have pandemic fatigue. But I keep hearing about cases that could have been prevented if people had just taken simple precautions. We're in stage 5, but we still need to wear masks and practice social distancing so that we can stay in stage 5. I can't emphasize that enough. Remember that even in stage 5, we still require social distancing and wearing masks, especially indoors. COVID-19 isn't going away anytime soon, and it will be months before a COVID vaccine is widely available to the general public. So let's use the tools that we have right now to keep our state open and keep Hoosiers healthy. I also want to provide a quick update on the progress of our school dashboard. As of Monday, we have had an additional 400 schools enter data into our portal. That brings the total number of schools reporting information to 1,755. Of those, 944 have reported one or more cases, and 811 have reported 0 cases. As you can see, 303 new positive student cases have been reported, 59 new teacher cases have been reported, and 79 new staff cases have been reported. When you add in the historical data that we requested since the start of the school year, that brings our totals to 1,992 positive students, 406 positive teachers, and 447 positive staff. We continue to see the largest percentages of student cases in those ages from 10 to 19. Our team is working with schools that have had technical issues or who haven't yet reported to ensure that we can get them access to the portal and remove any barriers to providing this information. We're also working on finalizing the list of schools that will need to report their data to remove duplications. As I mentioned last week, that likely will change the denominator. We've had several requests for downloadable data or a spreadsheet of school cases. We're working to compile that and hope to have it available soon. But our primary focus right now is on ensuring that we are capturing the data in the first place. Finally, I want to provide a quick update on the Bionox Now rapid COVID tests being sent out by the federal government. Indiana received an initial shipment of about 132,000 of these tests this week. And we are working to provide training in the use and the deployment test of these to facilities across our state. We will be using these in the areas where they are needed the most. These tests can give us a quick assessment of a person who has symptoms. If they come back positive, then we feel confident that that person does indeed have COVID-19. If they're negative and the person is symptomatic, we do recommend a PCR test because this is a much more sensitive test. Now I want to turn things over to Dr. Weaver to give us an update on our long-term care facilities.
Thank you, Dr. Box. So last week, I spoke about measures we have taken to provide and support testing in long-term care facilities. Additionally, as a review, IDOH have visited all long-term care facilities at the outset of COVID-19 to provide a comprehensive preparedness plan with education and a framework for infection prevention, and visited all of those facilities by March 27th. From there, we conducted on-site federal COVID-19 focus surveys or infection control QA surveys immediately when there was a first-time COVID-19 positive resident, and then had 3 consecutive day visits until the outbreak was controlled. Depending on the number of positive residents, IDOH continued to visit up to every other day. Starting on September 3rd, with the addition of IDOH's infection prevention specialists, facilities with the first-time COVID-19 positive resident again received an on-site COVID-19 focus survey or infection control QA walkthrough survey by the next day after the first report of a positive resident case. That visit was then followed by an infection preventionist who was assigned to that facility, visiting the facility to review and educate on infection prevention practices. Surveyors also continue to visit and contact the facility based on the number of cases. As of this week, we have completed 4,465 visits to nursing homes and residential care facilities. The facilities have additionally received support through additional funding, strike team testing, testing supplies, PPE, and education. Our residents in long-term care will continue to be at risk due to the very nature of their age, comorbidities, and the congregate setting. Therefore, we must continue to do all we can to support them. IDOH will once again be going to every facility to proactively inspect for proper infection control practices and will perform infection control surveys in every facility by the end of October. Those surveys will place additional focus on screening of employees, mask use, proper cohorting, proper use of PPE, and visitation practices. We will continue to provide infection prevention support and training with our infection prevention teams, both proactively and for outbreaks. Additionally, to assure that all staff have received standardized and consistent education, we will be requiring all staff to complete COVID-19 infection prevention education tied to funding. Long-term care facilities have already been receiving education from IDOH in weekly and biweekly webinars and newsletters, but this additional education will assure that everyone explicitly understands the steps needed to provide protection to this population. We will also continue to utilize IDOH epidemiologists to identify root causes for outbreaks. We do want to thank the frontline long-term care staff who have done a tremendous amount of work to care for long-term care residents in Indiana. We recognize the burden of the additional work, hours, and concern for your residents this has had on all of you. Please know that we support you. As cases rise in a community, the likelihood of having an outbreak in a facility also increases. It is really up to all of us to protect these vulnerable people by following the guidance of mask wearing, social distancing, hand hygiene, and minimizing social gatherings. Thank you.
Thanks, Dr. Weaver. So now we'll be happy to take some questions.
Today's first question will be from Eric Berman, WIBC.
Hello, Dr. Buck.
Hey, Eric.
Questions 1 and 1A, I guess. Last week, the governor noted that there was a lot of blue on the map, which was encouraging. There's about a third less blue this week. The positivity rate is at 5%, which both you and the CDC have set as a line of demarcation. So I know you've been reluctant to have specific numerical guidelines for we need to roll back, but what would it take to, more generally, if not a specific number, why is this not grounds for concern and to roll back, and what would it take to move backwards?
So, Eric, it is grounds for concern. There's no question about that. But I think if you look, about a half of our counties are still in blue and not experiencing an uptick in the number of their cases or positivity at this time. I think what's really important, and a part of the reason that we introduced this map and are continuing to use this, is so that we can localize those areas where we know we are having more cases, where we know we are having more hospitalizations, and to work individually with those particular counties or districts to make sure that we address with them those options available to them, which are the same things that we've talked about before, is continuing to reinforce the wearing of masks, continuing to reinforce the need for careful hand hygiene, social distancing, the options that they have, whether they would decide to decrease the size of different gatherings that they have, or options to change the number of individuals within particular businesses or other facilities. Was that 1A and B, or?
The next question is from Dan Carden, the Times of Northwest Indiana.
Hey, Dr. Box. The city of Chicago is threatening to add Indiana to its naughty list of states that it recommends its residents not travel to because of our rising cases. What is your response to that?
Well, my response to that is that other states and cities have done this intermittently, and that we have times when we have more hotspots, and other states have times like Illinois where they have more hotspots. So what we continue to focus on here as the state of Indiana is what we know works, and that is the ability to make sure that we are wearing masks, that we are social distancing, that we are doing the best hand hygiene and sanitization that is possible, and continuing to impress upon everyone the need to stay home when they're sick, and to answer our contact tracers if they get tested and they're positive, so that we can continue to trace all of these cases and quarantine and isolate those individuals that need to be.
Our next question is from Erica from the State House File.
Hello, can you guys hear me?
Yes.
Excellent, good afternoon. My first question, I have two, is about the school dashboard. Dr. Boggs, you touched on the fact that you are working with schools to solve some technical issues and get more data reported. But as of right now, we have over 1,000 schools who are not reporting. So do you feel confident in the numbers that we're seeing at this moment across Indiana schools?
Yeah, I feel confident that the schools that are reporting are giving us very good data and information, and we are continuing to work with some schools that have encountered difficulty in actually accessing the portal and giving us the information. We're also working with those schools that we have not seen any attempts for the data yet. But I think most importantly, our schools have been very overwhelmed with trying to keep up with contact tracing, reporting cases, helping us to quarantine individuals, make sure that their students have food for those times that the students are virtual. So we're really working in partnership with them, and expected that this would take a number of weeks before all schools would be reporting and giving us information.
The next question is from Meredith of WLFI.
Can you hear me?
Yes.
Hi. So my question is in concerns to long-term care facilities. You mentioned that there's a lot of education going on, several webinars, but what seems to be the biggest factor that's continuing to cause these outbreaks in long-term care facilities? Because it seems like this has been an issue since the pandemic began.
Yeah, that's a great question. So when our surveyors and our infection preventionists go in and when our epidemiologists review the cases, there are some common themes. For example, proper mask wearing, the correct screening of employees so that any symptom that they are sent home until they get a test back, cohorting of residents, et cetera. But I do want to add, there's also facilities that seem to be doing everything right. And just by the sheer fact that you have a lot of people that are very vulnerable to getting this disease in these tight, closed spaces, it does just inherently increase the risk of COVID-19 patients. So really that is why I want to emphasize the importance of making sure that we control the level of COVID-19 in the entire community, because the people who work there, they're out and about in the community, and they could potentially bring it into a facility and not even know it, being asymptomatic, and maybe they're, it's a couple of days before they get their next test or whatever it may be. So we're working really carefully with the long-term care associations and all the facilities to make sure that everything, all the proper precautions are in place and that they're following those to the letter. But like I said, I mean, it's quite complicated.
The next question is Nikki Kelly of the Fort Wayne Journal-Gazette.
Hi, I have two quick questions. The first is I've noticed that I guess I want to know when we moved from sort of a holistic statewide approach to actions to this new approach of handling individual county outbreaks and letting things be done on a smaller range. And then secondly, there are positivity rates out there from the Johns Hopkins University of 13% for Indiana, which is obviously far different than the 8 or 5% we have on the state websites. I'm getting more and more questions from people who don't know who to believe. And so could you just talk to Hoosiers about the different data and who they should believe?
So Nikki, I don't think we ever moved from not being focused or working with individual counties or individual districts with regards to this. From the very beginning, even at times when we had large outbreaks, we worked with our individual preparedness districts, our individual hospital districts to make sure that we worked right there with them, that they had everything that they needed, whether that was PPE, ICU beds, ventilators. We have continued to, on a daily basis, as we go over things in our meetings, identify those counties where we see outbreaks, especially in congregate living or other areas, or areas where we just see more community spread. And we make calls on a daily basis, probably to between 5 to 10, maybe sometimes as many as 20 different local health departments and oftentimes elected officials and hospital systems to discuss what's going on in the particular county or community. What we did was we reached a point where our percent positivity as a state was, we were happy with where we were and felt like we needed to start to address the state more individually, because we still had a lot of counties that weren't having cases in a significant number or outbreaks. And so at that point in time, we decided to more specifically address it county by county, community by community as our top priority. But I would say that, a lot of people have told me that being in stage 5 means that we're back to normal, kind of pre-COVID, and it really doesn't. It means that we're continuing to social distance, not only within our restaurants, our gyms, our bars. We're continuing to wear our masks inside. We have the ability to work with local communities, and they can control their large events that they have. So I think all of those things are in consideration and have been from the very beginning. And the second part of it, I'm not specifically familiar, but I do remember that at the past I had looked at Hopkins and they were using individual numbers of people tested. And, we've been very transparent about the fact that we started with individual numbers of people being tested, but it didn't make sense that somebody being tested and being negative in March and now being tested again in August or September, that test wouldn't matter, because it's still a measurement of community spread at that time. So we still calculate both of those. Those are both still on our website. If you look at our dashboard, But we have chosen going forward to use numbers of positive individuals over total numbers of tests done.
Our next question is from Darius of Fox 59.
Can you hear me?
Yes.
Hey, good afternoon. I had a quick question talking about the increase in hospitalizations. I know you talked about those elective procedures happening now, but if you could just speak to the fact that there are over 1,000 people who are hospitalized, and from these hospitals, we're hearing that these are COVID patients. So why the increase if you're able to talk to that? I know we just finished Labor Day, so didn't know if that had anything to do with it.
I think that Labor Day certainly can be contributing to our number of cases. I think the important thing to remember with hospitals is that we have maintained and continue to maintain our ability to care for these patients, whether they're COVID-19 patients or non-COVID-19 patients, that we have personal protective equipment available, that we have ventilators available, that we have the staff that we need to do this, and that we have hospital systems working together if they do need to transfer patients. But that has really not been an issue to date. When we look at this, though, you are correct. Our total number of COVID-19 patients or people suspected of COVID-19 is elevated. When we looked back in August, we saw a significant increase in the number of individuals in the younger age group that had COVID-19. And then the concern is that as those individuals are out in the community, they go home to their families, they go to family gatherings, weddings, funerals, whatever that is, that they tend to infect older individuals, whether that's their parents or grandparents or friends and family members. And then we start to see that in older age groups. And we saw the increase in that 40 to 60-year-old age group and even 70-year-old age group. And that is the group that we know will translate into more hospitalizations.
The next question is from Steve at KPC Media.
Good afternoon. How are you two doing today?
Doing well, thank you.
Just wanted to check. We've seen the increase in cases recently. We've seen the increase in positivity recently, increase in hospitalizations. There's been a small uptick in the average daily deaths as well. So I just wanted to ask, is there some particular trends that we're seeing? Is I know for a while we were talking about a lot of cases getting into younger populations, which generally fare better. Are we starting to see some impact of, just wider spread overall, or spread into some of these more vulnerable communities again? I guess is there some new emerging demographics that are suggesting that maybe this is getting back to some populations where we don't want to see it again?
I think that goes back to something that Dr. Weaver said, and that is our elderly individuals that are doing their very best to be secluded, to not go out, to try not to be in contact with this virus. By nature, as their grandchildren and their children get this, and we see those numbers increasing in the community, they're going to be at higher risk for those infections. Those individuals who work in our long-term care facilities, who work in disability homes, who work in other congregate settings, whether that's the Department of Corrections, will be at higher risk for bringing that in when they're asymptomatic. And so that is what's really key here, is trying to keep those numbers down by continuing to test everyone who is a close contact, test everyone who's symptomatic, and continuing to contact trace and to quarantine or isolate those individuals as appropriate.
Next question is Samantha from WFIE.
Good afternoon. Can you guys hear me okay?
Yes.
Perfect. Dr. Box, just two quick questions for you. First of all, down here in our region, specifically in southwestern Indiana, we have seen a significant increase in our cases over the past few weeks. And with the latest numbers, all but one of our counties, as you know, are listed as orange or red. So with contact tracing now being conducted at the state level, I guess, what are you able to share with us in terms of specific events or even places where we might be seeing this community spread?
So we have specifically looked at that, and we'll have the opportunity to share that. I talked last week with the local health officers, all of them from that region. Dr. Weaver met with the hospital systems from that region, and we are having more conversations tomorrow with the Southwest region of Indiana. What we have found with our contact tracing is significant events like funerals, weddings, There's been some association with different bars and restaurants. There has been association with athletic events at our high schools in that area. So those are the things that we have been sharing with our local health officers there, and we'll share more completely with them going forward. Most all of them are engaged very closely with our centralized contact tracing in following that also on a county by county region.
Perfect. And that leads me into my next question really well, was just the fact that we know we see a lot of these cases at congregate living settings, but specifically with the increased cases, is the state currently, or would it here shortly, advise local officials to take further action now that we're technically in stage 5?
So we have discussions on a regular basis, as I've already mentioned, with our counties and local cities and communities about options that are available to them to take. Most all of them are very familiar with it. We encourage our local public health officials to work closely with their elected officials as they decide what is best for their communities.
Up next is Brandon, Indiana Public Broadcasting.
Afternoon, Dr. Box. I have two questions. The first one might be can you tell us next week, but it goes back to Nikki's question about the Johns Hopkins numbers. You've talked about how the state is focusing more on total positivity versus unique individuals tested, but that still doesn't explain the jump from something like 8% where we are with unique individuals and the 13% we're seeing Johns Hopkins report. So even if you don't know the answer right now, maybe that's something hopefully we could get an answer to next week, because like Nikki, I'm hearing a lot of people who are wondering about that discrepancy. So I guess my second question then is, it feels like this, so maybe that's why I'm asking, but at this point, is the principal focus of the state just making sure that we're not overwhelming our hospital system and everything else is just, we'll muddle through until there's a vaccine?
Wow, I don't think that's the approach that we've ever taken with regards to this, is that we'll muddle through this. I mean, I think we have been very specific with each stage, and as we've gone to each stage, about the data that we're using to make these decisions and the data that we're using to stay here. And so I would say that we have been very clear that those options available to us today, those mitigation opportunities that we have, such as mask wearing, social distancing, careful hand hygiene, staying home when you're sick, getting tested when you're sick, following up with contact tracers and quarantining and isolating as appropriate, are the same things that we had in March. And those are the things that are going to sustain us as we go forward and until we get a vaccine and can have more of our general population vaccinated. I would like to say that one thing that may be an issue with the Johns Hopkins data is that they may only do PCR data. So they may only look at that typical nasopharyngeal nasal swab for PCR. But I definitely will look further into that and try to have an answer for you next week.
Our final question is from Andrew at WRTV.
Hi, good afternoon. My question is in regards to the flu season. We're hearing a lot from different hospital systems and doctors encouraging people to get their flu shot to avoid a twindemic. Are you seeing any flu cases or flu deaths yet?
We have not had those reported. There may be some cases. Lindsay, you work in the emergency room. What are you seeing?
We're watching carefully for it. And I will say too that we've already begun surveillance, which we do every year, looking for flu. We have the ability to test for both flu and COVID with our surveillance system. So that will give us more information. And we're also collect information on what we call ILI, or influenza-like illness, to start arriving to the emergency departments. But we have not seen a big uptick as of yet, but we'll be watching that very carefully. And Dr. Box and I both agree, please, everybody, go get your flu shot.
Thank you very much.
Thank you for joining us today. An advisory will be sent regarding next week's briefing.